Anything that breaks down stigma can make a difference for people, and you never know when yours is going to be the voice that unlocks something that makes a huge difference in someone's life.
Boom. Hey, I'm Greg Grunberg, and welcome to Talk About It, the podcast where we focus on topics that everybody should be talking about, and hopefully they will be, not only talking, but screaming about.
Epilepsy shouldn't keep you from doing anything that you want to do.
Talk about it. Talk about it.
While we will continue our focus on epilepsy, of course, we will also look at other health conditions and causes. Our goal is to knock down, drag out, and eliminate stigma and raise awareness. Each episode, you're going to hear from amazing advocates and champions. You will learn, as I will, about how we can all help to make a real difference.
Talking about it is important. It's all about connecting.
Talk about it.
Talk about it.
Talk about it. Talk about it. Thank you for talking about it.
Thank you for talking about it.
Talk About It is sponsored by Seizures Are Signs. Seizures Are Signs is dedicated to educating those living with or caring for someone with uncontrolled seizures about the importance of early diagnosis, recognition, and treatment. To learn more, please visit seizuresaresigns.com. Seizures Are Signs is made available by Jazz Pharmaceuticals. All right, so let's jump right into this episode of Talk About It. If you've been listening to me talk about it, and I've been talking about it and screaming about it and dancing about it and singing about it and playing drums about it, Talk About It has evolved. Now, obviously, we're helping so many different causes and organizations and things, and just so proud of the work we're doing. But the biggest collaboration, the most important collaboration that I've personally been able to make happen is the Caregiver series. If you haven't seen the Caregiver series, you can go to the caregiverseries.com. And please check this out. I'm so proud of the work that we're doing. I'm traveling around the country, talking to fellow caregivers, meeting the parents, meeting the spouses, meeting the families, taking the caregiver away from their family for a couple of hours and giving them a day of care. Because as caregivers, we need that. We need to be able to take care of ourselves and be healthy, both physically and mentally, to be able to take care of others. It's wonderful to meet other people that are going through similar things. To talk about it is one thing, but to actually hug about it and cry about it and laugh about it, it's just been so incredibly rewarding. Now, I can't do this without support. And Jazz Pharmaceuticals, this company, I've partnered with them, and they have said, no, let's make this a real show. So we have a real crew, and we're devoting real time to it. I'm traveling the country. And, you know, there are 3 million people plus, 3 million plus people that are dealing with epilepsy and seizures. And you factor in their family and their friends and everything, and it ripples out like to, 100 million people that know or care about and are concerned about someone who's dealing with seizures and epilepsy. Okay, so here we go. The first in a series of conversations that I'm going to have with the heads of pharmaceutical companies and charity organizations. This time, it's Bruce Cozadd from Jazz Pharmaceuticals. Enjoy. Bruce, thank you so much for taking the time to do this. You and I have been working together now for a little while, and I could not take the opportunity to do an episode all about your incredible company, the support you're giving the community, and especially the projects that we're doing together. So thank you for taking this time.
Yeah, thanks for inviting me. I like spending time with you, Greg, because I know your work's important, and I think where we intersect, we can make a difference.
Absolutely. I want to jump right in because I know how valuable your time is. So for people that don't know, all right, you are the CEO of Jazz, and Jazz Pharma it's just an incredible company. But first, take me back to how does one get into this space, and why? Why did you even decide that pharma was something you wanted to get into?
Yeah, well, it sounds weird when I say it, Greg, but I decided in 10th grade I wanted to be in this world of biopharmaceuticals, which, given that I was in 10th grade in the 1970s, is telling you something, because it was a brand new industry. It was exciting. It's probably what people in the 50s and 60s thought of, aviation and space, right? It was promise and peril, both, of unleashing new technology to try to improve human health. And as I studied molecular biophysics and biochemistry and, thought about getting a business background so maybe I could help run a company, I majored in economics along with molecular biophysics and biochemistry and went on to get a graduate degree in business, I always had as my North Star, I want to be in a company that creates new cures for patients and makes them available. And so I've been laser focused on that for a long, long time. And of course, being in the industry has taught me both how hard this is, how hard this work we do is,
Yeah.
risky, capital intensive, but more important, how rewarding it is when you see the impact you can have on a patient. And I do like to think about the patient, the singular individual and their family.
Yeah.
But then also thinking about how we do that for patients around the world.
So when did that click for you? Because I've been doing this advocacy work on behalf of my son, Jake, and the epilepsy community for so long, through this podcast and through talkaboutit.org and now the Caregiver series. And I have yet to expand. And there's wonderful people, as you know, in this business.
Yeah.
A lot of them work with you at Jazz. People tend to get affected by a condition and then they devote their life to it. We've seen that over and over again. But when did it click for you? And I think I know the answer, but when it was more about the patient, because you're so caring.
Yeah.
The whole company is. And I just not experienced that. And nothing against anybody I've worked with before, because everyone's well-intentioned and they're great. But to this level, it's just wonderful to see.
Yeah. So, my reason for co-founding a company back in 2003 was to accomplish two things: to create a truly patient-centered company where you really understand what your purpose is, and I'll come back to that, but then also to be a great place to work. So I care about people, whether those people are the patients we serve, but I also care about people because people are who comprise the great company and do the work we do every day, and I care about them as an employer as well. But it's meaningful to be in a purpose-driven company, right? Where you're going to change the world in a good way. And I don't mean that we're not going to change the whole world, but for the patients who depend on us, we're going to change their world, right?
Yeah, for sure.
And so if you've worked in an environment where the work you do fundamentally has a positive impact, it's easy to get more motivated about it, right? It's easy to lean in a little bit harder. And so from the beginning back in 2003, Jazz has been about innovating to transform the lives of patients and their families, and the people who choose to join the company and the people who choose to stay at the company. And we even have a group called Boomerangers who've left and then decided to come back to the company.
Those are the I told you soers? I told you so.
All those people share that passion to make a difference for patients.
Yeah. Well, but it is a business. And so what is the key? If there are other CEOs, other business people out there, how do you balance that? How do you balance, the care and concern that you have for patients with scaling a growing company? And you are taking risks all the time and we'll talk about that later, on new therapies and new things that you know about. But how do you balance the two to devote equally, or maybe in this case, more so toward the patient and the caregivers?
Yeah, well, I say we want to build a great company for patients, for employees, and for shareholders, for all three. We can't keep doing what we're doing, which is in investing substantial amounts of capital in risky R&D, if we don't have revenues. And every dollar of our revenues, every dollar of our sales is because a physician has chosen a Jazz Pharmaceuticals product to help her or his patient.
Yeah. Right?
They've decided that the offering we have is for that patient the best benefit risk balance, right? Is the best choice for medication for them. So we measure things in dollars. We report as a publicly traded company our results in dollars.
Yeah.
But to our employees, every dollar of that revenues represents a patient receiving treatment, right?
Yeah.
And so we have to be about patients. We have to provide the best treatment for patients. And it's all about what makes a difference for that patient.
Yeah.
If we have a particular technology approach and we say we like this approach or that approach, the patient doesn't care in the end whether the medication is a pill, an ointment, an implantable. They don't care whether it's a small molecule or a biologic. We care because we need to figure out how to research it, develop it, make it, distribute it. But all the patient cares is this treatment helps me. And so it has to be about what's best for the patient, right? Not what is easiest for us.
Yeah.
But I think keeping those two things in balance is important. And I know from talking to my employees over the years and from the employee surveys we do, that when you have the chance to be part of a team that's really attacking a big problem for patients and their families, you are more motivated, right? And I think that helps over the long run in getting the most out of our employees in a way that helps patients and helps our employees because their career development is more meaningful.
Right. And now I mentioned this in the intro, that I want to make sure people understand this is not a commercial for anything. It's not a commercial for jazz. I just have never experienced this level of collaboration and care. And I just wanted to reiterate it again because it sounds like, but I so love this company.
And Greg, let me say I'm passionate about the company I run, without a doubt. But if I could encourage anyone who's listening to this to do anything, it's think about whether there's a space in this industry for you. It doesn't have to be at this company.
Yeah.
Right? It's just a rewarding line of work to impact patients broadly. And I greatly respect healthcare professionals who take care of one patient at a time. That's a noble calling too.
Yeah.
We're doing something a little bit different. We work as a team over many years to develop something that we hope can, treat thousands, tens of thousands, hundreds of thousands of patients, making a difference one patient at a time.
And I'm seeing that with the caregiver series, which we'll talk about in a little bit. But, I'm traveling the country. I'm meeting caregivers. I'm meeting patients. And it is impacting their lives. It is changing their lives. And all the other therapies, little hints of things, this is all about the conversation that I have with other caregivers. And I learn, somebody says, you know what, maybe change the nap routine from this to that, or, little hints about diet and exercise, or whatever. Anything that I'm gleaning from these people, I take home and I tell my son and we discuss it. He's a grown man; he makes his own decisions. But it's amazing how much we together have been able to open up this dialogue.
Coming up on Talk About It.
Clinical trials don't always work. Biology is devilishly complicated.
Yeah.
But we try to make smart bets, therapies that, if they work, would really advance care for patients.
All right, so I just wanted to break into the interview just for a second, just to acknowledge the innovators, the inventors, the ones that we think are crazy for coming up with these insane ideas. Electricity, the light bulb, coffee, any of the things that we take for granted today. Someone had to come up with an idea, right? In this discussion, we're talking about medical breakthroughs and finding a cure for this or that, and the incredible work that the scientists are doing to find a medication that works. I don't know how any of that works. I'm just so thankful that they're so hard at work, working on these great things that are affecting so many lives. But when you think back, Thomas Edison, I remember hearing a story that Parliament overseas said, that's fine for our friends, our transatlantic friends. We don't need the light bulb. People laughed at him. Coffee, I mentioned coffee. When coffee was first introduced, way back, we're talking way back, people thought that was ludicrous. It's insane. And now look at coffee. And I know it seems trivial in comparison to medications that help people live a better life, but it's all the same thing. If you have a dream, be a dreamer. Be a dreamer. And by the way, the more they laugh, the better the idea. That's the way I live my life. So keep dreaming big. That's why I wrote a book called Dream Jumper. Keep dreaming big. All right, let's go back to the interview. Why jazz? Why are you calling this company jazz?
I do have a musical background. I play the piano, I sing, certainly have been active in that my whole life. And so musical analogies tend to resonate with me. There are people that come up to me and assume because of the name of the company, I only like jazz music. I'm here to say I like all music. I like good music.
Yeah. Except Nick Marzak's music.
You don't want any part of that.
So by the way, Nick,
that came from Greg, not me.
No. I don't know if you know. I've told you, I think before. Nick is the most talented singer-songwriter I've ever met. We met years ago, and we're like family. We do everything together. But he is a brilliant musician, and hopefully, at an event or somewhere. I know you tend to.
We'll jam together at some point.
That would
Nick.
be great.
Yeah,
That
you
would be
love
really
to
great.
do that,
But,
right? At when the company gets together, I hear you're in the piano. You're on the piano at the hotel.
I'm on the piano every night. My particular talent is I sight read, meaning if you put a piece of music in front of me, it doesn't matter whether I've seen it before or not. I can play it the first time I see it. And so when people want to sing
That's
along,
crazy. Love that.
I bring lots of music, music I know, music I don't know, and I say, throw it in front of me if you want to sing, and we'll do it. And of course, in today's technology enhanced world, you can pretty much download sheet music instantly. So if they don't have it, we get it for them.
Yeah.
And Greg, he's a jazz guy, which means he knows all the chords that you need, like an encyclopedia to look up. Like he has those ready
But
to go.
don't you, Nick? I mean, when you're at when you're playing a bar or you're playing a gig and someone throws something out, I've seen you do this.
So him and I are opposites in that
We're opposite. I can't do that.
He's the sight reading guy. I'm the ear guy. So it's funny to get us together. That would be a heck of a jam.
I know, but in music and in jazz, especially jazz, there's an improvisational side, where someone could go off and solo, and it's encouraged. Is that thematically? Is that tonally? Is that something that you encourage at the company? Where it's like, if you have a great idea and you want, it's like everybody playing together, but yet letting people shine.
Let me come back to the question you asked, which is why jazz for the name? Given that I like all music, I was starting to say hip hop pharmaceuticals just didn't have the same ring to it. But
that is awesome.
The metaphors I liked about jazz music are two.
Yeah.
Number one, if you think of a jazz musician, you tend to think of a virtuoso. You tend to think of somebody who's an awesome trumpet player, saxophone player, vocalist, pianist, right? They are masters at what they do. And yet, jazz is inherently a collaborative music form, right? It's always played in a group because jazz is listening to and responding what somebody else does, right? It's being present in that moment. And so I like the metaphor of it's about having people who are individually expert at what they do, but it's all about how they play together.
I love that.
Right? It's not about I got a bunch of superstars who can't talk to each other.
Yeah.
It's about how you perform together. And the second metaphor that I liked was going to the point you were making, Greg, about improvisation. We might call it innovation in business. But how is it that jazz musicians, if they're making it up as they go along, can literally get on stage in front of a live audience and jam? Like, if they're all making it up, how the hell does that work?
Yes.
And of course, the answer is it's improvisation on top of an understanding, a structure of the music.
Yeah.
Right? It's the time signature, it's the rhythm, it's how many bars are you going to play, it's what key are you in, right? There's an underlying structure that the musicians understand. So in business, I think about that as we operate in a highly regulated industry, and highly regulated for really good reasons. If we make a mistake in manufacturing, it doesn't mean you burn your toast.
Right.
Right? Somebody could die.
Yes.
Right? So we have to get it right. We're in a highly regulated industry. Well, if you're operating with lots of restrictions and rules, how is it you're innovating? And the answer is you can improvise on top of structure. Mm-hmm. So I like that metaphor as well.
Yeah, and also being able to be nimble. I know just for what we've done together, I'm out on the road and we've got this incredible team, and there are regulations and everything, but it's freeform enough that we're able to have real conversations, and you're not afraid. I certainly haven't been, but when we collaborated and we said, okay, let's go out and do this, I was afraid that I couldn't have these real heartfelt, and epilepsy is not easy. It is really, really tough. It is the worst at times. And we celebrate these victories every single day. Nick, you're Jake's like a brother to you. So you see, Jake, I'll be late and Nick will say, what's up? And I say, Jake had a breakthrough this morning. And luckily that happens maybe once a year, so Jake's doing really well, is living well with it. But still, it's like to be able to have these tough conversations and have the good conversations. It's, I don't know if it's exactly what you mentioned, but to me, it's just that freedom, I should say, to really have real.
And Greg, that brings back for me, I just noticed on social media the other day, the head of one of the patient advocacy groups in this space. And, the people that run patient advocacy groups are heroes to me.
Me too.
It's a labor of love, and they're trying to make a difference for their loved ones, but for the broader community. and I'm not going to name her here, but she was designed, all set up to go talk about the impact of the disease and, educate. And she wrote that she had to cancel it because she was dealing with, essentially a health crisis in her house. And
Yeah.
she was talking about how hard it is that every day of your life, in some way,
Yeah.
is impacted in small ways or in overwhelming ways
Yeah.
because you're dealing with a condition that most people aren't dealing with.
Yeah.
And that varies. You and I happen to know a lot about epilepsies. It's true of other conditions too, that when you really understand the burden on not only the patient but the people around them, you understand how life-changing it is.
Yeah.
And how therapy is part of, but only part of, how you best accommodate that and how you live the best life you can.
It hit me when I saw it. I was like, oh, because you think she is doing incredible work. And not that it's untouchable. She's untouchable. She's on top of it. She's got it all going on. This is one of the reasons why I do what I do is because I have control over this. I don't have control over Jake's condition. And all I want to do is trade places with him. And I want to do whatever I can. So at times I'm like, yes, I'm beating epilepsy because I'm doing something about it and I'm making a real change and I'm helping. And then all of a sudden you see something like that, which, by the way,
I'll tell you personally, I
Yeah.
went to write a response to her and I never hit send because I don't feel like I can, because I cannot fully appreciate what she's going through.
yeah, it's interesting.
I did the little, not like emoji, but, care or whatever. But
Yeah.
I thought I don't have standing here to say, hey, I know what it feels like, or, I'm sending positive thoughts, obviously.
Right.
But it's so hard to understand what families and caregivers are going through in moments like that.
Yeah. And, when I do meet another caregiver in my position, there is such a shorthand. There's such I take this deep breath or this exhale where I'm like, oh, you just get it. So talk to me about the future of jazz, because I can only imagine, like I've invested in little things here and there. I created an app years ago and it was like, ooh, that's really risky. You're dealing on a whole nother level, and forget financially. You're gambling on, and in the best way, that something can change lives. And it's a massive financial gamble. Like how do you weigh that? When do you take those risks? And just talk to me about that.
Yeah, so, as we come up on 20 years old in March 2023, the company's in solid position. We've got growing revenues. We've got a healthy R&D pipeline. But you've got to keep making these investments, right? So we'll spend, a lot of a big fraction of our revenues on R&D expense in 2023 as we propel ourselves toward what we've laid out as Vision 2025 and beyond. Right? That's part of our strategy, invest more in innovation. And we know in that portfolio, not everything's going to work. Clinical trials don't always work. Biology is devilishly complicated.
Yeah.
If it were easier, we'd have better answers to more diseases. But we try to make smart bets, therapies that, if they work, would really advance care for patients. That doesn't mean they're gonna work, but our goal is to invest in things that, if they do what we think they do, will represent really differentiated treatments for patients. In neuroscience, which is one of the areas we're in, sleep medicine, epilepsy, other movement disorders, and oncology, acute leukemias, solid tumors. So those are the areas we've staked out where we've got some knowledge, we've got some resources, some good customer connections that help us learn more about what patient needs might truly be.
Yeah.
But we've got to keep taking risks. And again, some things will go right, some things will go wrong. Hopefully you're doing enough things that on balance, you'll be okay. But no guarantees. And it's really hard in our industry to succeed for a long period of time.
Yeah.
Because you're going to hit setbacks. Our company has hit setbacks in the past. I'm happy to say we've made it through them. I'm sure we'll hit setbacks in the future too.
Sure.
That's part of what we do in a not completely predictable business. But again, if you're all excited about the impact you can make, people are committed to that. You do the best experiments you can and you live with the results. The data's the data. and you keep moving on, and people in the world around us keep innovating, right? Our innovation at Jazz comes in part from our team, and in part from academics, people in startup biotech companies who innovate and make some progress. Maybe they can't take something all the way across the finish line given the requirements of doing multinational clinical trials and regulatory and commercialization. So maybe we're a good partner to get them across the finish line. But that innovation is happening around us every day.
Coming up on Talk About It.
I have secrets I have to keep for years. My buddy JJ and I, he is the king of secrets. He's doing Star Wars and this and that. And he's like, don't say anything to anybody. Knowing clinical trials are working, how do you keep the secrets that are in your head? Breaking into the interview one more time, just to talk about listening, putting yourself in a position to learn. When I'm doing the Caregiver series, I am listening even more than I'm hosting or I'm talking or I'm trying to navigate the conversation. Because if you put yourself in a position to learn or to try and get some sort of information from somebody, you're going to find answers. You're going to hear something that's going to change your life or the life of the one you love who might be dealing with an issue. So put yourself in that position. Go grab coffee with a group of friends. Don't be afraid to sit down with people that might be going through similar situation to you. No one is going to be going through the exact same situation, have the exact same diagnosis as you or your loved one, but don't be afraid to engage in that conversation. No one's going to judge you. Get on a chat group, join something online where they're discussing it. Just make yourself available. Put yourself out there. The more you listen about it, the more you learn about it, the more you can talk about it. All right, let's get back to talking and listening with Bruce from Jazz Pharmaceuticals. Back to the interview. What you're doing is just, so important. What I do is kind of superficial, but we both are taking chances. Nick, your music. I mean, it's like you pour your heart into something and you hope that it's accepted. You hope that it works. You know what I mean? I'm shooting a new show right now in Albuquerque, and I'm hoping that it works. There's so many things that have to click for it to actually be well received and whatever. But my biggest question to you, Bruce, is I have secrets I have to keep for years because I'm on a project that doesn't come out, and it's like my buddy JJ and I, we work together, and he is the king of secrets. He's doing Star Wars and this and that, and he's like, don't say anything to anybody. Don't tell anybody. How do you keep the secrets that are in your head? I'm talking about knowing clinical trials are working, things are exciting. I mean, for us patients, for people listening to the podcast right now, to know how excited you are about the future, it just makes us feel better because it says, okay, this is going to be a robust pipeline and it's not too far away because things are moving so quickly in this space.
Well, I'll say there's a limit to that secrecy, Greg, on two dimensions. Number one, we're a publicly traded company. And so we have disclosure obligations if things are material to our business.
Yeah.
We need to let investors know that. Good news and bad news, both, by the way. The other thing is we're working in the field of science. Mm-hmm. And there's a way science happens in terms of publications, publishing data so people can learn from it, whether that data is positive or negative. Mm-hmm. There are rules. Again, we're in a highly regulated industry. There are rules about disclosing when you move into later stage human clinical trials. That has to be public to some level. So we're not keeping a lot of secrets. And honestly, when a lot of clinical trials are ongoing, you don't know what the result's going to be. The best clinical trials in our industry, not always practicable, but the best clinical trials are placebo-controlled, randomized, double-blinded, which is a lot of words that mean you don't know, the doctor doesn't know, and the patient doesn't know whether they actually got your active treatment or not. And so if you see some patients getting better, that's encouraging.
Yeah.
It doesn't mean they're the ones that are on your drug. And so until you unblind, until you look at the data where you actually separate who was on active treatment and who wasn't, and what were the benefits and what were the liabilities, right? What were the adverse events? What went wrong?
Yeah.
Only then can you really judge whether you've got something. Now, I will say in rarer diseases, and we've collaborated a little bit in some less common diseases.
Yeah.
You sometimes do trials that aren't quite designed that way, and you may have a little more of an inkling as it's going along as to what's working. But again, given the public company and science lenses we work through,
Yeah.
we don't have to keep too many secrets for too long.
Yeah, I mean, I shouldn't use the word secrets. I think it's more exciting news. Like, how do you keep
Oh,
this
yeah.
exciting news to yourself? You know,
Yeah.
and for me, it's like, it's so exciting. I want to call my aunt and tell her, hey, I'm on this sitcom today. You know what I mean? But I want her
Yes.
to see it herself. You have exciting news brewing all the time. And, but I hear you. I mean, you have to serve both sides. Yeah.
Yeah.
Okay, so what do you say to people that about this robust pipeline and your company, the whole industry, when they hear about something? How do you? Because this is what I preach all the time: get a second opinion, talk to the doctor, mention things. Don't be afraid to do that, because what I've learned is these heroes, these neurologists, these epileptologists, they want to hear this stuff. They can't go to every
No, exactly.
convention and talk and read all the publications, right?
I mean, here's what makes me optimistic, aside from the fact that I am just an optimistic guy. The pace of innovation in our industry across diseases is picking up. The advances that are being made every year, every 3 years, every 5 years, every 10 years, are just larger than they used to be. And so one of the things I say to people is you're generally better off being diagnosed with a disease today than if you had been diagnosed 5 or 10 years ago.
100%.
And it'll probably be true again that you'll be better off if you're diagnosed with a disease 5 years or 10 years from now, or maybe even a year from now.
Yeah.
And I'm in a position to hear patient stories where our intervention, our new treatment, or our clinical trial came along at just the right moment where they were diagnosed and in need of a better answer.
Yeah.
Whether it was their first therapy or they had failed other therapies and they were moving on. And so I'm optimistic because our choice set, our armamentarium of treatments, and I don't mean just my company, but across the industry, is getting better and better and better.
Yeah.
And that gives me hope. But you're also pointing out that importance of accessing the best information. We want doctors to have the best information when they make treatment decisions. We want patients and caregivers to have the best information, as you said, not just about medication, but about how to live your life, right? A lot of this is practical tips for how you manage a disease and how to make it work with your life so your life can be the most fulfilling it can be.
Yeah.
And that can be from peers, right? Other people that, as you say, speak the same language, right? That have an understanding of that disease state.
Yeah.
It can be anybody in your life who's a support to you.
Yeah.
But despite your self-deprecating comment about what you do is not as important, anything that breaks down stigma, anything that informs can make a difference for people. And you never know when yours is going to be the voice that unlocks something that makes a huge difference in someone's life.
Boom. If that isn't like right there's the tagline in the trailer for this episode. By the way, we're calling this episode All That Jazz.
I love it.
So, you're so right. And I think it all starts with talking about it. And, I'm bringing it back to the podcast, but that's really what it is. Like, there's so many people that feel alone. They feel isolated. They feel like they're the only ones going through it. And I know we did when Jake was first diagnosed at age 7. We didn't have family and friends going through this. We didn't know, we were searching for the right care and therapies and everything. And the more we talked about it, the better we felt, the more information. Because when you look something up online, all the bad stuff rises to the top. It's just the way it is. But if you engage, with your physician, engage with, the community, find people, talk to them. Don't be afraid to talk about it.
And other people draw strength from that and inspiration from that.
Yeah.
We just had a moment in Dallas. We had our U.S. kickoff meeting a couple weeks ago, and we had 2 patients on stage, both young adults, who suffered from the same disease. And it's not a common disease. It's called an orphan disease because fewer than 200,000 people in the U.S. Have it. In this case, far fewer than 200,000. But there was a great moment on stage where one of them, 2 of them, looked at the other one and said, you're the first person I've ever met live in my life that suffers from the same disease I do.
Wow.
And I thought, it just like the air went out of the room as we all thought about that. To be that isolated. Now these patients were dealing with their families, they were dealing with friends, they were dealing with the healthcare system.
Yeah.
All the people that work in that hospital or treatment facility, right? Not just the doctors, the incredible nurses, the support staff, right? They've had to share this experience voluntarily or not, in the case of the healthcare system,
Yeah.
with loads of people, but never before had they had the experience of being able to have a conversation with someone else that understood what they were going
That's
through.
mind-blowing to me. And
Yeah.
yet I understand it. Even with something like what Jake, what we're dealing with in our family, and there are millions of people that are dealing with a similar thing. I too will I'll come across somebody and they're like, I don't talk about it. I don't want, and all that does is, put this barrier around yourself that you really, again, you feel like you're the only one going through it.
Yeah.
So to that end though, this is what I'm so excited about. This is what we've done. So for people that are listening to this and watching this, if you don't know, you have to know. Go to thecaregiverseries.com. We have partnered, and I've been talking about it forever. You guys have been talking about it forever. And suddenly what was great is in this conversation that we had, we decided, wait, let's do this. Let's do a real show where I go around the country and I talk to other caregivers, and we use the caregiver as the way into the conversation, because like I do on Talk About It, I use celebrities' faces to get people there to educate them on what to do in case you see someone have a seizure and all of that, and answer questions. But this dialogue that we've opened up, this show, these episodes, these wonderful people, what was it like when you first were pitched this and you were like, well, first of all, what was it? Did you know who I was? Were you like, yeah, Greg Grunberg wants to partner. We want to partner with Greg. What was that first reaction?
Okay, well, Greg, I didn't know you.
Okay, we're done with this interview. Turn it off. No, Nick, turn that off right now. That's it.
I knew characters you played.
Oh, okay. Yeah.
I knew about I don't know whether to use the term celebrity, but you're a known figure in the world.
Yeah.
That's different from knowing the person.
True.
And I feel like in our time together, we've gotten to know each other as people a little bit. And I saw that your commitment to this community was deep and heartfelt. That this was not I'm going to get plaudits for doing something positive that, sign me up for a little time on that. You can tell, and you connected with our employees at the first meeting I met you live. You didn't do a little talk from stage and then run off to your next thing. You engaged with people and you made a difference to them. You motivated them.
Yeah.
Which helps them motivate physicians, which helps get better treatment for patients, right? So it has a big impact. So when I heard about this project, to specifically talk about caregivers, not in their derivative role as my job is to take care of a patient, but in their primary role as this is impacting me too.
Yeah.
It's impacting what I can do with my life, how I spend my time.
Yeah.
Attention I can devote to another child or to a significant other or my work. It's changing my life too, and making that primary, not derivative. I don't know if I'm using the right terms here, but throwing the spotlight on that for a minute.
Yes.
And focusing on them as people, I thought was so impactful. And of course, in the end, it does tell the story of a patient too, but starting with a different lens. And so I love it.
Yeah.
I love what you're doing. I hope more people have the opportunity to see it. If you see it and you like it, tell a friend about it.
Yes, talk about it.
It's just really powerful.
Yeah, and I have to say that, I'm out there, and because I'm the face of this, people come up to me, and I've been getting so many more people every day that'll come up and I think, they're going to say, I saw you on this or that, and they acknowledge and they thank me and they give me an attaboy and a pat on the back or a hug and say thank you for what you're doing, because and you touched on this. We a lot of these people, these are rare conditions. They're rare forms of epilepsy, and we've been able to explain it through the caregiver and understand it more. It's just been so incredibly rewarding. But I have found, and I've been surprised, other conditions, caregiving is caregiving. I don't care if you don't have a condition, which would be wonderful in your family. You're still a caregiver. You still care about the ones you love, and like you said, you can take little tips from it and say, wait a minute, I'm not spending enough time with my spouse or on my work or on this sharing that. I've learned so much from them and they've learned from us. And so thank you.
Including I need to take care of myself to be able to take care of you.
Yes.
Right.
Yes.
And we find, I know you find when you go out and talk to these caregivers that tends to get a backseat sometimes, the taking care of yourself, because you're so focused on taking care of someone else in a loving way.
Yeah.
That maybe you've forgotten you got to take care of yourself first, ultimately for the benefit of everyone.
Yeah. No, I couldn't agree more. Well, okay. Again, just have to tell you how much I love you for the support and for just the way you think. We are so in lockstep, and I feel so privileged to be working with you. I'm going to tear up because I know what it means to my family and I know what it means to this community. I hope we get to continue to working together and do more episodes. You know, in Hollywood terms, I'd be begging for a next season pickup, but. But I'm so happy with everything we're doing. I mean, right now I'm able to, because you guys sponsor so many great events with so many different charities and organizations around the country. It's so great that I get to be a part of that. If I can go, I'll be there. If not, I'm doing these videos now. It's just such a connective, it's a great way to connect with the community and really bring us all together. And we're doing it. We're not just saying we're going to do it. We're doing it. So thank you for that. Thank you for being on the show. And for our relationship and trusting me and this crazy vision I've had.
Yeah, no, thank you again for the invitation. And I'm always glad to be part of your work. I'll just say broadly again, we're in the business of creating and distributing better medications for patients. That's what our scientists, that's what our R&D folks, that's what our commercial folks do.
Yeah.
But we also realize that when we get involved in these diseases we choose to be part of, that the needs of the patient community are greater than that. And I don't want to pretend we're going to solve all those needs. We're not. But where we can make a contribution to better diagnosis, better education, supporting advocacy groups that do so much work, including on destigmatizing diseases, making resources available to patients that need them.
Yeah.
We like to do our part. And again, I don't want to overstate our role in that, but where we can make a difference, we like to make a difference. And that's why we're aligned with you, Greg. You're trying to make a difference. You are making a difference, and we're happy to be part of that.
I really feel like we're jamming. I mean, this is what we're doing. We're jamming. And, and we will get to the music. Nick is chomping. Nick's like, I want to play with this guy. We will get there somewhere where we'll come together. But thank you for, for doing that. And thanks for coming on the show. I really appreciate it.
Yeah, my pleasure.
Okay. I hope you enjoyed that conversation as much as I did. There are hopefully going to be more episodes. If you haven't seen the Caregiver series, please go to thecaregiverseries.com. And also, since we mentioned it, check out Nick Marzak's music. Where can they find your music? Because we mentioned it. Music has been such a big part of this episode, but I just want to give you a little plug.
Thank you so much. NickMarzak.com, Marzock.
As always, go to talkaboutit.org, talkaboutit.org, and thecaregiverseries.com. Thank you for joining me, and Nick and Bruce. Thank you so much for your time, and thank you to everyone at Jazz and everybody in the community who's supporting this great series that we're doing. We will see you next time on Talk About It. Well, that's a wrap on another episode of Talk About It. Remember, we're all human. We're all dealing with something, and a little compassion every day can change so many lives. Thank you to our special guests. Special thanks to our sponsor, SeizuresAreSigns.com. Thank you to J.J. Abrams for our theme music. Thank you to Nick Marzak for producing, directing, editing, and incidental music. On behalf of my fellow producers, Phil Gattone, Ken Lohenberg, and Nick Marzak, thank you for listening. Thank you for watching. And if you're not watching, go to talkaboutitonvideo.com to watch these episodes. They're now on video as well. I'm Greg Grunberg. Don't forget to talk about it, and I will see you next time. This podcast is a production of the Talk About It Company.